Friends, I, Dr. Sanjay Pandey, as a consultant urologist at the Kokilaben Dhirubhai Ambani Hospital, look into the urology and the andrology services and understand that a lot of men come with a problem called as refractory erectile dysfunction. Erectile dysfunction itself is an issue where men complain of decreased capability of performance in the bed, decreased rigidity of their organ, and sometimes the tumescence is not so much that they can penetrate. And they go through a trauma of morally going down because the medication sometimes does not work in a individual, which means that some people do very well with medication, and I probably take them forward in a journey of improving their erections on a very medical setup. That means a medical management of a lot of patients who have got organic and psychogenic erectile dysfunction, where they have a progressive or a sudden onset erectile dysfunction where they've not had the result that we're aiming for. And it's all quite depressing because they were very good some days ago, some months ago, some years ago, and things have been progressive. Some people complain of a sudden onset erectile dysfunction, which is more related to their partnership, more related to their psyche, more related to their anxiety. And also, obviously, there are trigger events and precipitating events. So on one side, we look at erectile dysfunction, which is treatable medically, where we do a very step ladder approach, where we look at SOS and a maintenance and induction dose and probably keep them stable around. But there's a subset of patients whom I just labeled as refractory erectile dysfunction. An erectile dysfunction which is not improving with medical management, with counseling, with sexual counseling, with partnerships around, and they keep seeing sexologists and our colleagues in medical practice, but the erections are not improving. They're not capable enough, whatever they were. And who are these people? Who are people who develop refractory erectile dysfunction and where we need to help them around is such an important aspect. So people who are long-standing diabetics who have got diabetes for 8, 10, 20 years, but diabetes has probably been not in complete control, number one. They could develop an erectile dysfunction because of a microangiopathy happening in the penis, which therefore does not let the blood flow in and out very well. And these erectile dysfunctions are almost labeled refractory, where medical management, vacuum erection devices, injectable therapies don't work. The other group of patients who could add on to this trouble could be diabetics plus smokers. Smokers do develop a similar kind of problem where smoking brings about changes in the penile vasculature, not letting the relaxation contraction happen the way it normally happens for them in their younger age group or in their past. As a result of which, the capability of blood flowing into dilated sinusoids, where the erection becomes strong and good, does not happen again. And they are the ones who suffer from a refractory erectile dysfunction which does not help them. People who have got spinal diseases, which could include anything with a spine surgery being performed for a spinal tumor, or those very progressed kind of L4, L5 compressions where things have become such where urinary and even the bowel functions have not been very good. People who underwent spinal trauma and spinal injuries in the past where they've not recovered or recovered only partly. These people do suffer from erectile dysfunction, which is a lot neurogenic, a lot refractory, and almost does not improve with any kind of a medical or a minimal invasive management. So these are all quite refractory and quite a debilitated state where we need to improve and stabilize them. People with some central nervous diseases also do develop refractory erectile dysfunction, and that doesn't improve with time. So basically, a large group of people are those who are with these kind of organic issues around. There's obviously an idiopathic group where attempts at medical management did not improve and the disease progressed. And these progressions can happen around. So I'm looking at refractory erectile dysfunction in men in their young prime of life who probably are not able to capably perform sexually with their partner, and the partnership is going into a difficult situation. That's where we talk about something called as Peyronie's disease, where we look at somebody is developing an erectile dysfunction where there is a bend or there is a kind of a shortening of the penis. The penis is soft, and we look at that aspect too as a part of the entire conglomerate of refractory progressive erectile dysfunction. Friends, erectile dysfunction, which is progressive and refractory, where medical managements, injectable therapies, and vacuum erection devices, which have got little meaning or no meaning alone, would require andrologists, would require people like us in the Department of Urology at the Kokilaben Hospital to improve this to the next possible level. Over the last 25 years, being involved deep into andrology and looking into sexual dysfunction of both men and women, it is important that we probably take this awareness to the front row seat to a lot of young men who probably suffer in agony and don't know what to do and where to go to and how to take it forward. So your andrologist, your uroandrologist who is deeply involved in the subject, few in every city. Now we look into this subject by looking at giving you a therapy and a cure. So if the penile organ otherwise is not deformed, otherwise is looking adequate in terms of anatomy, but the capability of its functionality is going down, we look at something where we do a penile prosthesis implantation. What does it mean? The penile prosthesis is a prosthesis or a foreign body which is implanted in the penis, which helps you to be able to serve the function that you were aiming for and not able to perform, which medical management and various kinds of sex therapies and counseling did not work, where a partner participation did not completely work, and you're bereft of the capability around. So when we look at that aspect, we look at refractory erectile dysfunction can be cured by a penile prosthesis. What am I talking about? So penile prosthesis or a kind of an material within the penile shaft increases the capability of erections, which are either completely erect most of the time, which is called as malleable or semi-rigid erectile devices, or there are inflatable erectile devices which come at a cost. If I give you an example of that, so these are all those semi-rigid malleable processes which can be implanted into the shaft of the penis. You look at one of those most versatile ones, which is available right now in the world, which has an inner nitinol core. And this core allows it to be bent like a ratchet, and we can conceal and hide it well. So capability, concealability, and probably versatility of the organ is improved in a refractory erectile dysfunction which has been failing for months or years, and we not had the answers to it. Therefore, malleable or semi-rigid process which have been accepted very well by the community at large and by andrologists who actually utilize this, look at various kinds of processes which are available. So all of them have got capability, all come at different sizes, and each of them is utilized the way it can be used best. So each of them have got a kind of a capability. So you can see that they can be all hidden, concealed, and they make you capable because they have got a kind of a turgor which is given to the penis when it is implanted internally. So each of these which I show you, of them which I implant very regularly, all of them have got different kind of capabilities. All of them can be hidden, concealed, make you capable in a refractory erectile dysfunction. So extremely important for make this awareness to our young men, to men who have got cardiac issues, who have got neurological issues, who have got spinal issues, and who have got refractory issues where medical management doesn't work. So spinal issues, central nervous system issues, patients who have got a penis with no erectile capability left over, diabetics, smokers who lost their erection completely are cases of refractory erectile dysfunctions. These are all malleable processes. I use them every week, every month, intermittently as patients do come and as we assess and work them up and identify their requirements and their patients and partners' requirements. So these erectile dysfunction therapies are extremely capable ones which we use for individuals who have got refractory erectile dysfunction, which means that an erectile dysfunction was progressive, was organic, or there were issues which would not let him make capable around. I obviously implant this when I do a phalloplasty. I do phalloplasties for absent or a small or a micropenis, or in transgender states where I create a female to male phallus, and there we implant this as another aspect of care. So when I look at the versatility of various machines available for the man in question who takes care of the moment of a lot of people who can get the magic back to their lives, it is important for us to enthuse you that if you have got refractory erectile dysfunction, you are treatable and curable. You will never grow old. Maybe your black hairs may turn gray, but obviously the capability in bed increases and improves. It is important for us to take this forward to the next level. So I suggest that let's look into this not with an aspect of going down the hill, but with a hope that tomorrow's can be better than today's when we look at erectile dysfunction can be treatable and curable. On one side, we treat many patients medically, we enthuse them, we make them capable, and I always tell them practice makes a man perfect. The more you practice, the better you are compared to the man on the street who's better than the man who's attempting to look at the muhurat to perform. And many of them miss it out. Similarly, in Peyronie's disease, majority of them have called a curvature and a bend, which we improve and make them straight, partly medically, but many of them come late and are refractory in terms of erectile dysfunction and the bend, and we straighten them up. Those who have got multiple kind of plaques and those who have got an erectile dysfunction along with a bend, we actually give them a penile prosthesis. So the subject was to be brought to the front row seat in 2024 because men should be men, they should be capable males. On one side, they should pass urine well, which the prostate could trouble in future. Other side, their diabetes uncontrolled, their neurological issues, their spinal issues, and their smoking all takes a toll on their erectile dysfunction. It is important for us to take this completely forward because all sexual dysfunctions can be treated and cured. Many people come with various other aspects of sexuality, and it's important for us to take them forward. So at the Kokila Midhirubhai Ambani Hospital, where I serve as a consultant neuroandrologist for the last 15 years, it's a pride to be able to help in the journey of men who go through trouble. Though we look at a lot of female urinary aspects, the entire aspect of female urinary issues is listed out there. A huge amount of female urinary issues and sexual issues is seen. But when you look at men and we look at them as drivers on the partnership, drivers of aspects which are very good and progressively changing, urology andrology requires completely a front row seat. It's important for us to take it forward to the next level by identifying that we are in trouble and we need to get sorted out. People come from various cities, countries, and various places in Mumbai who probably have been treated in the past. They have not got their answers or the results have only been in moderation. Therefore, isn't it time in 2024 to get ourselves polished on our urinary aspects in terms of uroflows, getting the flow better, in terms of sexuality where our erections are good enough and we continue to do better. So friends, refractory erectile dysfunction is treatable and curable with these malleable processes, which we use more commonly only because the cost is lesser than the inflatable processes though for those who can afford. This probably gives you the erection back capable enough along with conceivability and capability, which would make you and keep you a man, never grow old in terms of your capability. As I sign off, I look at more and more men identify themselves maintaining their health. And if the health goes somewhere haywire, I think it's important to streamline health and bring it back to the front row seat. That's why this awareness matters so much. Thank you so much and continue maintaining your